introduce myself. So hi, I'm Jessica. I'm a student nurse at Bevel State Community College, and I'm here to perform your trach suctioning and trach care. So then I would also identify the patient, and since they can't talk, I would ask yes or no questions. So I'd ask like, is your name so-and-so? And I'd get a response. I'd say, is this your date of birth? And I'd also ask if they have an allergy to latex or any other unknown allergies. So then my patient is covered. I have all my supplies, my NB bag, my PPE, and my gear, and I also have my hand hygiene. So I'm gonna go ahead and perform that. I'll also put on my PPE. First, I would do a respiratory assessment. So I do that, and I'll also leave, or I do their pulse oximetry, and I'll leave it on their finger throughout the procedure to be able to monitor it. Then I'll put on my PPE. Fall. Put on my mask. And then that was good, but maybe I'll stay up. I'd perform hand hygiene again, and then I'd open my tray. So I would open it away from me. And grab my gloves. Grab it with my non-dominant hand. Ooh, my fingers are going on the wrong side. And I put this on the wrong side completely. But I can fix it once I get my other glove on. And I can slide this paper out of the way. Next, I can open my saline. Throw that away in the trash. I'm going to keep it just in case if I need to use it again for practice. And then I would get my suctioning device. Throw that away. I put it in between my pinky finger and my ring finger and wrap it. So I would have my oxygen on 100 to 120, and I'd have it on continuous flow. So then I would hook it to suction, and then I can hold it with this hand, unwrap it. I would use my thumb, and I could test my suction. Contain it again without going 1 to 2 inches away from my valve. I would also have the head of the bed no lower than 30 degrees, and I'd give my 5 breaths. So 1, 2, 3, 4, 5, and I do it in a normal breathing pattern. I would unravel it, and I would go in without touching the outside of the catheter. I would go in until I felt resistance, or I saw the patient was wanting to cough. And as I was doing this, I'd put my thumb on the valve and I would twirl it no longer than 10 to 15 seconds, and as I'm coming out. So after that, I would contain it again. I would give 3 more breaths. Unravel. I would cleanse my tube with the saline again. I would get it, contain it, And then I would perform 5 more breaths to the patient. And then after I do this with my non-dominant hand, I will remove the gauze, dispose of that, contain all of this, dispose of it. And at this point, I would unhook my ambu bag from my oxygen. I would put back on the trach collar, and I would leave my oxygen on 100%. And I would also document what I did, and I'd also leave the patient. I couldn't lower them back down any lower than 30 degrees, and I would leave their bed rails up and call light and reach.